It's Chris Beyer.
Chris Bowling.
Brad Johnson here.
Morning, Brett.
Another bottom line Thursday.
Love it.
What do you have for us today, Brad?
You want to talk about generational differences in healthcare
Yeah.
and not to get too deep, but just kind of interesting
Yeah.
stuff because I know everyone on the call probably has different populations at their workforce and they might see different trends. So we had a
Yes.
number of groups this year that saw 20% increases that if they're fully insured, some self-funded groups had zero to a little bit higher than that. But
Yeah.
demographics drive so much of your costs. So I thought, let's spend a minute to dive into that if you're up for it.
Yes. Yes, please.
Let's
So
go.
first I got to get the boring stats out of the way, right?
Uh,
And then we can have a good
Okay.
conversation. So I'll give credit to the Health Action Council. It's a nonprofit. Can't say I'm real familiar with it, but they did a
Okay.
study with United Health Group, who owns Optum, who has pretty incredible data.
yes.
And so they looked at spending by generation. So I'm just going to hit some big stats. So
Okay.
the oldest, and they're looking at the workforce, not the retired population, but the
Right.
workforce. So baby boomers only make up about 10% of the workforce anymore. Most have retired, so I'd say roughly 62 years of age and older. That's probably baby
Okay.
boom ballpark. 10% of the population make up 22% of the cost. So to
That
no
makes sense.
surprise, the older we get, the more we spend on things. Next one down, Bowling and myself, Gen X. So you're probably talking what, mid 40s to up to about that 61 years of
Yeah.
age, make up about 26% of the population, but
Okay.
36% of the spend. So again, not quite as big of a differential as the baby boomers, but Gen
Yeah.
X, if we look at in total, actually has the highest spending of all, just because they make up the largest share of a population.
Makes sense.
And now we're spending more than we account for in terms of population. Millennials and Gen Z, 20%, 14% of the population make up about half the spend though. So that's the kind of the emerging
Wow.
workforce, right?
Yeah.
Here's what's interesting about it though. As we all get older, we have higher healthcare costs. I think what was
Yes.
interesting about this study though, as we dive deeper, is the concern that the younger generations, so we're talking millennials and Gen Z, are showing higher rates of chronic conditions like diabetes and hypertension, and they're emerging sooner. And so I think that's problematic. So even though as we look at a workforce, every year you
Yeah.
get your renewal, they ask for a census. Why is that? Because they're trying to get at this stuff.
Yeah.
But
And you're
I
always
like,
saying that the younger population is going to help your risk. I mean, that's been the anecdotal
Yeah.
statement.
yeah, and it will, but just not as much as it used to, which is kind of crazy. So there's the stats. Check out the newsletter for the full link, but
Dang.
I'll pause there and I'll kick it over to you guys.
Well, I think just, if you're talking about high blood pressure and diabetes, it's our diet. you
100%.
know, Growing up as barely a millennial, almost an Xer, ate really well when I was younger, and then more crap as I got older because it's easier and more available. But you think of I'm sorry, Gen Z, that's all they've had.
Yeah. I mean,
Terrible food.
dude, it was a treat for our parents to take us out to dinner.
Yes.
And,
Yeah.
I mean, we dressed up because it didn't happen very often.
Yep.
And, mama made me my lunch every day. I didn't eat that
Yep.
that that cafeteria crap. And now it's just all processed crap
Yep.
food. I mean, like you said, Byron, we did not grow up going out to eat. It was
No.
had mama's meal.
Yes, all the time. And it was interesting. Like my grandparents, if we would go out to eat, it was a family restaurant or it was a dive bar for actual food. It wasn't fast food. Like my grandpa would never go to a fast food restaurant ever. He would go to the, hole in the wall spot for a burger because they actually made it.
Yeah, real
Well,
meat.
Brad, you mentioned this too, but then also, dropping the age for colonoscopy to 45. I know several people in their 35 to 45 range that have had colon cancer, some that I've known that have passed away that young. And I mean that's not supposed to happen.
No,
Yeah,
no, that's scary.
yeah.
I
Hey,
mean,
Bowling, going back to your thoughts so about cafeteria food when we were younger, I give props to school cafeteria rectangle pizzas. You remember that?
Oh,
Okay.
100%.
Okay.
I would eat
Just
that
making
right
sure we all
now.
live in the same world here, because
I would eat that right now.
nothing to
Yes.
shout at or nothing to be, upset about.
Yeah, the
No.
mac and cheese, you might want to pass on that because that was
Yeah.
just synthetic
Yeah.
orange stuff that was poured over.
Yeah,
Well,
I also was a bring the lunch every day kid, but yes, on pizza day, I'd also get that too, just because.
it's save your quarters
Or,
because you
or
were
you can show off your Charlie Brown lunchbox, one of the two. You eat school lunch or show off your cool lunchbox. So that's all I
Yes.
got today, guys. But yeah, interesting stats.
one cool thing
Yeah.
about that generation, and we've all seen it in the news, is that alcohol consumption is going way down in that generation.
Yeah, significantly.
Yeah, you're
How
right.
toxic that is on top of everything else that they eat. So yeah, it's scary, man. We got to do something different in this country. That's for sure, because we're all getting crap way too young.
Cannabis
Yep.
is up though, so you wonder if it's an equal. I need to look for a study on that. So
No, so true. Yeah, it's the California drunk
yeah,
is the term. So,
Right.
I'll
They're
put
gonna
my
be,
mind to that research. We'll see what I can find.
yeah, that's awesome.
okay.
They're gonna be healthier, but a little bit less brain cells.
Mellow.
Yeah.
Dorito sales are going to go through the roof.
Ooh, I could eat some Doritos.
Going back to the GLP-1.
All big circle.
Thank you, Brad.
All right, guys.
All right.
Appreciate it, Brad.
All right,
See
we'll
you
see you.
guys.
Yeah, bye-bye.